Welcome to Wellness Wednesday. It is Dr. Latoya Wells. I am so grateful that you are here with me again tonight for another episode of Wellness Wednesday. It has been a week, but I'm grateful. It's a new month. It's the 1st of May. My birthday is coming up this month. I am going on a solo trip to Costa Rica, and I'm just grateful. I'm so excited. Welcome to Wellness Wednesday. This is Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. We are located at 452 Osceola Street, Suite 106. And our phone number is 321. I'm sorry, no, it's not. It's 321-306-6755. You can find us social media, so Facebook, Instagram, TikTok, YouTube. We're there. Our website is wellslegacyhealthandwellness.com. So just to get those from formalities out of the way so we can jump into our discussion for tonight. Tonight, what I want to discuss, and you guys know each and every month I like to discuss a health topic, one that's poignant, one that's important, and one that's going to bring exposure to different things and provide you with some knowledge, tips, and things of that nature. The month of May, as you all know, each and every month I like to focus in on a health topic that's being highlighted globally. And so tonight, our topic will be mental health. This month, the month of May is considered Mental Health Awareness Month, among other things that are highlighted. But I want to focus on mental health. It's something that, even though I'm a primary care provider, primary care nurse practitioner, family practice nurse practitioner, I see patients of all different ages. But one thing that I know for sure is that our mental health impacts our physical health, and how important self care is. It's so important that we take time to take care of ourselves and that we are taking care of self. And so when I'm working with some of my patients who are coming in with anxiety, depression, or they're coming in and having, different symptoms, many times, and not all the time, but there are many cases where these individuals are dealing with anxiety, they're dealing with depression, and it's showing up in their physical bodies. So tonight we're going to discuss mental health in the older adult. As we go throughout the weeks, I will have some special guests here with me for Wellness Wednesdays. There will be posts and information posted on the social media page for you all. Let's get plugged in. Let's really focus in on our mental health. And it's the perfect time to do so, right? So thank you all again for being here. We're going to delve into it. You guys know I love statistics, so we're going to talk about some statistics. But this is a topic that's close to many of our hearts. Supporting the mental health and well-being of our loved ones, especially the older adults, is so important. I can remember my paternal grandmother, and I didn't realize it until later, once I became an adult and was in nursing school and was doing my mental health rotation. And I just remember some of the medications that my grandmother was taking. And I was like, oh gosh, she was really dealing with a lot. And being young, I really didn't know. But once I became of age and was actually working in the nursing field and got to be around others and take care of patients who have mental health issues, it wasn't until then that I realized the magnitude of it. And, I'm not going to put my age out there. For those of you guys who know me, know my age, but I just talked to a colleague of mine and she was just like, welcome to getting older. I was telling her some things that I was experiencing in my body, and she was like, welcome to getting older. And I can recall a couple of weeks ago, I was just having this conversation with, in journaling, and these thoughts came to my mind like, oh my gosh, I'm getting older. And when I look in the mirror, I see the changes. And so for a minute, I was just like, man, But then on the other hand, I'm grateful that I am getting an opportunity to see another year. So for that, I'm grateful. But when we're looking at the older adults, and as we age, we may experience life changes that impact our mental health. I know and I know we're talking about older adults, but I like to be transparent with you all. There are some times in my life where I've dealt with some heavy issues when it came to mental health, anxiety, depression, things of that nature, are some of the things that throughout my life so far, I've dealt with it on several occasions. And so having worked with the older population and having family and friends who are older, to witness the changes that happen in them as they age as it relates to their mental health. And so one, it's never too late to get help. It's important to remember that older adults may have different mental health symptoms. For example, lack of interest in activities. And as a healthcare provider, whenever I am assessing a new patient or seeing a new patient, there's something called the PHQ-9, which asks questions based on to help us determine if someone is dealing with anxiety, depression, or things of that nature. But it's a shortened version. It's the PHQ-2. And there's two questions that we ask. One is, have you felt in the last 2 weeks, have you felt down, hopeless, or depressed? And then the second question is, have you lost interest or pleasure in doing things that you once enjoyed or normally enjoy? And so a lot of times when we're asking these questions to some of the older adults, there's a gradual separation of them moving away from the things that they once enjoyed doing. And so that's one of the first indicators that there's something going on. Talking about mental health can help older adults feel more comfortable and asking for support. I remember taking care of a patient, and she had 9 children and 27 grandchildren and great grandchildren. And she was dealing with depression, and she was lonely, and she felt disconnected from her family because she was used to being around family and having people at her house and cooking. But, as people get older, your kids get older, and I'm learning this now, as your kids get older, they have their own lives and they're off doing their own things. And you don't necessarily have that togetherness like you once had. It looks different. There's togetherness there, but it looks different once your kids and your children are older. And so she was really dealing with a lot of loneliness and depression. And we really had to walk through that with her and talk with her. And I referred her to mental health counseling to go and speak with someone, and she was able to talk about it with them. Mental health treatment can be a part of a wellness program to help older adults live healthy, happy, fulfilling lives. And it's important to, one, as a healthcare professional, to be able to pick up on those cues, and as family members to be able to notice the changes. And sometimes it's very subtle changes, but they do happen. And we have to be able to tap into that when we see it happening and react to make sure that we're getting them the care that they need. As healthcare providers, we need to have a network of mental health professionals that we can refer our patients to. And that's one of the things when I'm networking and when I'm reaching out across, outside of my clinic to other healthcare providers, to be able to have resources and a network for my patients. So having mental health professionals who can help older adults cope with the life changes is important, because they're there with them when these changes are happening, and so they don't feel so alone. I remember her telling me, I feel so abandoned. Like I feel no one loves me and no one cares for me. There's days that I go and I don't hear from my children or my grandchildren, and it broke my heart. And I had to do an evaluation, an internal evaluation, and be like, hey, let me make sure I'm reaching out to my family, my mom, my dad, because we can get busy. And even now, like with friends, there are some times where I may not talk to anyone outside of those who are in my immediate family in this house with me, because just life. And so we have to be mindful of that. I'm gonna get off my soapbox. So family and friends can experience meaningful mutual connections by spending time visiting with older adults. And it's just that simple of making the time and spending the time with them. And that's what this one patient, and not just this one patient, I'm bringing up this one, but I've seen many older adults who express this. And the key to understand is that mental health is important at every age. And there are things that we can do to help us with that. So the physical touch, the emotional connection, the spiritual connection, the community connection, and those older adults who have these different outlets tend to do better as they age. Provide you with a few statistics on mental health disorders in general, and then in the older adult. Mental health disorders affect people of all ages, and I think we know that. But older adults are particularly they're more vulnerable to that. And about 15% of adults over the age of 65 suffer from a mental health disorder. And that can be depression, which is the most common in the older adult. And anxiety is another one. And so it's important to be able to pick up on the changes, the subtle changes that happen in our older adult family members or friends, neighbors, or what have you. In terms of the signs and symptoms of mental health disorders in the older adult, it's essential for family members. It's important for family members and caregivers to be able to recognize these signs. And if you are someone who's around the older individual day in and day out, you can begin to see some of these signs and symptoms. But if you're not around and if you talk to them occasionally, you may miss some of those things. So one of the top things that we see, as I mentioned earlier, was lack of interest in doing things. They just don't have interest in going to, the community center where they used to enjoy. There's persistent sadness. They're always sad. They're tearful, and they have feelings of hopelessness. There's, as I mentioned, loss of interest in doing things that they usually enjoy, and changes in their appetite or weight loss. You'll begin to see that they don't want to eat anymore. Individuals who once enjoyed food, now their appetite is changing and they're losing weight. They begin to show fatigue and loss of energy. Mental problems or confusion can arise. Irritability and agitation, and then withdrawal from social activities or isolation are some of the signs and symptoms that we need to be aware of. Some of the warning signs that we need to pay attention to prevent crisis and make sure that we intervene quickly is one, the expressing of self-harm or suicide. Oh, I just rather not be here anymore. I feel like my family would be better if I wasn't here. I feel like I'm such a burden. These are things that I've heard. These are phrases that I've heard from my patients who were dealing with depression and anxiety. Neglecting personal hygiene and self-care. You have a gentleman, and I'm speaking of a patient that I had before, who was very well dressed. He was very well put together. His home was always clean and immaculate. He knew, very sharp gentleman. He began to go into a depression after he lost his wife, and he began to neglect his personal hygiene and self-care. He wasn't hungry anymore. He wasn't eating. He wasn't getting out of bed, and he was expressing thoughts of suicide. Increase in substance abuse. And this is where we really have to pay attention, especially if there's medication in the home, narcotics, if the individual is dealing with chronic pain or back pain or what have you, and there's narcotics in the home, there can be an increase in substance abuse. And so we really have to be mindful of that. Another thing is sudden changes in behavior or personality. This individual who was once very open and a social butterfly, now they're becoming very withdrawn, or they were very, nice and calm and even keel, and now they've become very combative or angry. And so it's important that we really pay attention. Another thing that we have to really look at is they're starting to give away their possessions, or they're saying goodbye as if they're preparing for a trip. And I had a patient, I didn't have a patient, but a colleague of mine had a patient who his wife was having some issues. I believe they sent him home from rehab or the nursing home. And this individual, if I'm remembering the story correctly, this individual started giving things away and saying goodbye and committed suicide, shot the wife and committed suicide. And so there were signs that were potentially missed. And so we have to be mindful of that. And we can't just blow it off. Oh, that's just nothing. It's probably not anything. And even if it is nothing, it's better to err on the side of caution than to not do something and something happens to that individual. So we talked about some statistics. We talked about some of the signs and symptoms, and then some of the warning signs that we need to be aware of. But as family members and as caregivers, what are some strategies, or what are some things that we can do to support our loved ones? What can we do to help them? One, we want to communicate, making sure that we keep the lines of communication open, create a safe space for them to be able to talk and express their feelings and concerns without judgment. Many times individuals don't speak up because they feel like they'll be judged. And especially if this is the matriarch of the family or the patriarch of the family, and they've always been the strong individual, they always have been there for everyone, and now they're struggling. And many will struggle in silence because they don't want to be judged, or they don't want to be seen as weak because they are dealing with depression or loneliness or what have you. Make sure that we're providing emotional support for them, offering empathy, understanding, reassurance, and let them know that they're not alone in their struggles. Many of these individuals, and many times we, and I'm saying we, I'm not, depending on who you ask, I'm not over 60, but I can be classified as an older adult, right? Depending on who I ask. If I ask my 10-year-old cousin, yeah, I'm older. But anyway, I digress. They feel alone. There's this sense of being alone or feeling alone and like you're all in this by yourself. And so making sure that we are surrounding them and allowing them to know that they're not alone. Encouraging and fostering social connections. So getting them out of the house and helping them to be involved in the social activities, maintaining regular contact with friends and family. So if we got to get a phone tree going, and each day in the morning, one family member calls, in the evening, someone else calls, at midday, someone else calls, or have a schedule of when we're going over to check on this family member, it's important. And then promoting a healthy lifestyle. Typically, when you're active and you're out and about, you're eating well, you feel better. And so physical activity, making sure that they're getting that exercise. And you all know 30 minutes a day of moderate exercise, at least 5 days a week, 450 minutes of exercise. A balanced diet, we're not going to go into that, but whatever they want to eat within reason, just make sure that it's a healthy diet. Making sure that they're getting adequate sleep. One of the other signs that was not mentioned previously is insomnia. These individuals can't sleep because they're dealing with anxiety, they're dealing with depression, their mind is constantly racing, and it's hard to find sleep. Or if they do go to sleep, they don't sleep long. They wake up in the middle of the night only after having a few hours of sleep. And after many days of that, it begins to wear you down, and the depression and the anxiety and the thoughts of loneliness and the feelings of loneliness only increase. And then healthy lifestyle exercise, it one helps them to also manage stress. Another thing is seeking help. And there are many ethnic groups and individuals who don't believe in therapy. And a lot of people are suffering because of that mentality. And so it's time to really take a shift in our thinking when it comes to professional help and counseling. We want to make sure that we're connecting them with a mental health professional who can, one, provide a detailed assessment, provide counseling, and then offer options for treatment. And treatment, meaning sometimes medication is what needs to happen, what needs to take place in order for this individual to get the help that they need. Not all the times will you have to go the route of medicine. There's many different treatments that are available that can help. But the only way to know what the options are is to get with a mental health provider. And then as healthcare provider, well, as loved ones and caregivers, it's important to learn about the situation. What does depression look like in an older adult? What can I do as a family member? What resources are available? How can I be supportive with them as they're on this journey to recovery? As healthcare givers, we talked about it before. As caregivers, I'm sorry, and family members, while you are providing support for your family member, it's important that you also are taking care of yourself. As I mentioned earlier, self care is caring for self. And that's one of the biggest things that we can do to help with our mental health, to make sure that we are healthy when it comes to our mental health. So, as a family member or a caregiver who's caring for someone who has a mental health issue, some of the things that you can do is, one, set boundaries, recognize your limits, and prioritize your self care to, one, make sure that you're not getting burned out. Make sure you have support from other family members or your community, your village. And I like to talk about my village. I have an amazing village of individuals who, when I need them, will show up. We may not talk every day, we may not hang out every day, but I can send one text message, or I'll be dropped on somebody's mind and they'll reach out. Hey girl, we just talking, thinking about you, just want to check on you. And so making sure that you have that support. Reach out to support groups and counselors, and there are many caregiver support groups that are available that can help you and that can provide you with the outlet. There is one that I know will provide respite care. So if that individual is homebound and you need someone to come in and stay with them, there's so many different references and resources out there for you. And one, understand that supporting someone with a mental health issue can be challenging, and it can be draining, and it can be hard. But your compassion and your presence can make a world of a difference to that person that you're providing care for, and also for yourself. And again, educate yourself, learn about the condition, effective caregiving strategies that can better help assist you. And then schedule regular breaks to make sure that you're getting recharged and rejuvenated. As a healthcare provider, I've taken care of patients with a wide range of mental health issues. And I've been there to support the families and the caregivers of these individuals with mental health issues. And it's a delicate balance to be able to set boundaries, but also be there and show empathy for those individuals. I don't know if I've shared my story here, but I can think of a few times in my life where I've dealt with depression depression, and most recently, about 3 years ago, depression and anxiety and panic attacks after the loss of my maternal grandmother, who helped to raise me. And her loss really took a toll on me. And if I'm being honest, I was already at capacity before her death. And her death was the one thing that just kind of took me over the edge, which caused me to go into a very deep depression and to deal with insomnia and anxiety really bad. And it wasn't until I started therapy that I really understood the magnitude of what I was dealing with. And there was medication involved. There was intensive therapy involved to get me back to, well, I won't say get me back, because I did not want to go back to where I was before this situation happened, but to get me to a place where I was okay. And there are days where I still struggle. There are days where I miss my grandmother like crazy. And but I have the tools, I have the techniques, I have the strategies that I can use and that I can implement that will help me get through it. Grief is no joke, and there's no timeline for it. And I just couldn't understand why I was not getting over this the way that I thought I should be. But I knew enough to reach out and get help. I knew enough that if I don't do something, then the outcome may not be good. And so, if you are someone who is facing or dealing with mental health challenges, or have a family member who's dealing with mental health challenges, I would encourage you to get help. There's the crisis hotline, and I want to provide you with that number so that you can reach out and get help. It's so important that we have the resources and that we have access to the resources to get the help that we need. That number is 988. That is the national line for crisis counselors. And there's the 211 services as well that can offer the health and social service assistance. But 988 is the Lifeline Crisis Counselor line. So if you are someone who is dealing with a mental health issue, if you have a family member that's dealing with a mental health issue and you need someone to talk to, reach out to us. Contact us. We will talk with you. We will be there with you. We will help you get the assistance and the care that you need. It takes 1 minute to make a phone call, to pick up the phone and dial 3 numbers, 988. So if you're someone who is dealing with a hard situation and you need someone to talk to, we're here. You can contact the National Crisis Hotline, 988, to get that care and assistance that you need. But just know that you're not alone. You're not in this by yourself. And if you are a caregiver and a family member of someone who has a mental health issue, there's resources out there for you as well. Next week, we will have an amazing individual that I met, Erica Turgeson. She's a social worker, and she's going to come on and we're going to discuss some more information on mental health in the community. Be on the lookout for social media. I'll be posting different graphics and different, videos and things of that nature that can help someone. Share the information, share the lives, because if it just reaches one person, then I've done my job. I've done what I've been put here to do. And I just want to make sure, one, tie it back to the mission for Wells Legacy Health and Wellness, to make sure that my family, my friends, and my community and my patients have the knowledge, the information that they need to be able to advocate for themselves and to create a legacy of good health. And good health means holistic health, the whole body, mind, body, and soul, and spirit. And so if you are someone that just needs someone to talk to, you need someone to pray for you, you need someone just to listen, we're here for that too. This is Dr. Latoya Wells. I am the owner of Wells Legacy Health and Wellness. I'm a family nurse practitioner. Thank you all so much for joining me for another episode of Wellness Wednesday with Dr. Wells. Stay safe and be well. Until next time, we'll see you later.